fall is a loss of upright position that results in the following: landing on the floor, ground, or an object or furniture, or a sudden, uncontrolled, unintentional, non-purposeful downward displacement of the body to the floor or ground or hitting another object like furniture or stairs. With that, let's talk about the responsibilities of our nurses and our residents. Our nurses conducts initial full risk assessment upon admission, and our residents acknowledges the high-risk status in the healthcare provider's notes and order sheet. Then, nurses reassess patients' full risk using inpatient or outpatient full risk assessment tool. Our residents must also evaluate medication profile in relation to full risk. Our nurses provides interventions for reducing full risk. And our residents evaluates and manages cardiovascular problems if patient is hypotensive, orthostatic, and symptomatic. Our nurses informs resident on the current full risk score and document to healthcare order sheet. Our residents evaluates and treats pain. And also, our residents' responsibility is to get referral from physical medicine and rehab, geriatrics, eye institute, or ENT institute as recommended by patients' attending physician. Now, let's discuss the forms that we use for fall prevention. First form is Morse Fall Score. This form screens elderly patients for risk of falling to help the initiation of fall prevention measures. Let's interpret the scores. For score equal or less than 24 means the patient is no risk for fall. For 25 to 50, low risk for fall. While score higher than 50, meaning that our patient is high risk for fall. Next form is Humpty Dumpty Fall Score. This form is used for pediatric patients. Let's discuss the scores. For score 6, meaning that our pediatric patient is no risk for fall. While patient is low risk for fall if the score is equal or higher than 7 but not more than 11. And for score of 12 and above means that patient is high risk of fall. What to do if our patient is low risk or high risk? Here are the corresponding interventions for each full risk score. Let us begin with Adult Full Risk Assessment Tool, or also known as Morse Fall Score. For Adult Full Risk Assessment Tool, all status will use protective and preventive strategy when dealing patients with or without risk. Next form is Pediatric Full Risk Assessment Tool, or also known as Humpty Dumpty Fall Score. For our pediatric patient with score of 0 to 6, they are classified as no risk. With this, our intervention will be no risk standard protocol. This includes orientation to room. Patient and family are given fall prevention education and document fall prevention teaching and include in plan of care. While, for score of 7 to 11, our pediatric patient is classified as low risk, and our intervention will be low risk standard protocol. This protocol has the following standards. First, we need to follow no risk standard protocol. Next, bed must be in low position and brakes on. Third is side rails up. Assess large gaps, such as a patient could get extremity or other body part entrapped. Then use additional safety procedures. Then followed by inform patient or relatives to use non-skid footwear for ambulating patients. And also use of appropriate size of clothing to prevent risk of tripping. Sixth on the list is assess elimination needs. Assist as needed. Seventh is call light must be within reach. Educate patient or family on its functionality. And last is clear the environment from unnecessary equipment and clear from hazards. Assess for adequate lighting and leave night light on. High-risk standard protocol is used for score of 12 to 23. This entailed the following protocols. First, follow low-risk standard protocol. Then second, identify patient with fall precaution tags on the patient's chart and on the door. Third on the list is check patient minimum every 2 hours. And followed by dedicated watcher will accompany patient during ambulation. Fifth, place patient in an appropriately modified bed based on child development. Sixth, consider moving patient closer to nurse's station. Seventh is assess need for 1:1 supervision by a professional caregiver or nurse. Next, evaluate effects of administered medications. Then last is Use protective barriers to close off spaces and gaps in the bed. Now, let's talk about the steps we must know on what to do when we witness a fall. Step 1. Call local 88 and activate code white. But what to say when you call local 88? First, you need to greet, sample, good morning, or good afternoon. Second, state the code. For fall incident, you need to sound for code white. Third, state the location of the patient. Fourth step, you need to declare whether the patient is adult or pediatric. Because we have different rapid response team for adult and pediatric. And fifth, you need to state your name for reference. Second step. Call local 8777 or 6565 for safety hotline. But beyond office hours, you can contact them through 0905-282-7801. But what to send when you text the environment of care cell phone number? First step, state the kind of incident, sample fall. Second, type the information of the patient, like the name, age and sex. Third, give the details of the incident, like the location, date and time. Fourth, state your name. This is needed for reference. Last step, type hashtag fall alert, then send it to 0905-282-7801. Third thing that you need to do, after activating the code white and calling safety hotline, is go back and secure your patient. Fourth step. Documentation. Reportable event notification form. This form must be forwarded to Clinical Investigation and Analysis Department within 24 hours. And also the form will be accomplished by the nurse in charge or head nurse or supervisor in charge. Fifth step. Documentation. Accomplish fall incident report form. This form must be forwarded to Environment of Care Department once staff in charge arrived in the area. The form is divided into two sections. For Section A, this section will be accomplished by the nurse in charge or head nurse or supervisor in charge. While Section B, attending physician or resident on duty will accomplish the section. Patient safety is our concern, and safety begins with us. That ends this module. Please watch out for our next fall prevention episode.